Some illnesses do not stay neatly inside medical language. Instead, they find a way to enter the room at night. For one elderly woman with advanced thyroid cancer, her days and nights were interrupted by chronic wheezing, shortness of breath, a fading voice, and a deep, inescapable cold. The true weight of her illness was measured in the exhaustion of trying to find a comfortable position, catch a full breath, and simply rest. Her clinical situation was well documented. Scans confirmed structural abnormalities in her thyroid, alongside distant metastases. Given her age and physical exhaustion, she decided against pursuing conventional therapies like surgery or radiation. That decision left her family and caregivers with a difficult reality. When standard medical interventions stop, how do you continue to support a person's breath, comfort, and dignity? This space between aggressive treatment and absolute surrender is where the daily work of caregiving happens, and it's exactly the gap this case report addresses. Support came as a traditional Chinese medicine approach, centered entirely on a small, flat herbal pouch. It was placed externally on her lower abdomen at the navel. Nothing at all was swallowed. The therapy followed a calm, predictable routine. She wore the pouch under a soft belt for most of the day, replacing it with a fresh one every 6 days over a period of roughly 2 months. The practitioners based this treatment on a traditional multi-organ framework. Instead of isolating her symptoms, they mapped them as a connected system. The pouch formulation was designed to support this entire network simultaneously, bypassing the stomach for systemic relief without heavy pills. Addressing a complex physical decline sometimes requires stepping back to view the body's entire biological landscape, rather than chasing individual symptoms one by one. What stands out in the clinical notes is how early the caregivers observed a clear shift. By the end of the first 6-day pouch cycle, the daily logs recorded a noticeable decrease in her coughing and wheezing. Her breathing eased, her excessive sweating slowed down, and her hands finally felt warmer. As physical strain lessened, her mood stabilized, and she began speaking with a clearer, steadier voice. She even showed a spontaneous willingness to stand up on her own, move around the room, and participate in her day. Progress in supportive care rarely looks like a sudden, miraculous recovery. It usually looks exactly like this: a quiet return to the ordinary rhythms of daily life. The improvements continued as she moved into her 3rd and 4th pouch cycles. Her voice returned to a near-normal quality, and those previously frightening, asthma-like breathing episodes became much less frequent. The medical record notes a particularly telling detail during this period. She started doing simple arm exercises before bed, entirely on her own. But the treatment course was not a perfectly straight line. Her deep sensitivity to cold would occasionally return. She experienced brief episodes of mild hoarseness, and there were days when the pouch caused minor redness and irritation on her skin. The inclusion of these setbacks matters. It grounds the observation in reality, showing careful, honest tracking rather than a polished success story. After 60 days, the therapy was paused. At the 72-hour follow-up, she maintained her normal voice quality, her edema was stable, and she had only a mild, manageable cough. We have to be absolutely clear about the limits of this report. There was no follow-up imaging performed, and there is zero evidence presented to suggest the tumor shrank or slowed down. It is also important to note that the author documenting this case report is the inventor of the herbal pouch used. These caveats define exactly what this paper is and isn't. It is an observational record of symptom relief, not a claim of a cancer cure. Yet, for a patient with no other options, easing the effort of breathing and bringing warmth back to cold hands is a deeply meaningful achievement. If a gentle, external, supportive approach feels relevant to your situation, this case may be worth exploring more carefully and deciding on in your own way.